Hello, everyone. I'm Carrie Gillespie. I am the project director for early development and disability here at New America. I'm so happy to see you all. Welcome to those of you here in person and those of you out there virtually. Here at New America, we are right next door to the White House, where more than 35 years ago, the Americans with Disabilities Act, or ADA, was signed into law, stating that it, quote, promises to open up all aspects of American life to individuals with disabilities, end quote. We're here today to discuss if the ADA has lived up to that promise. New America's disability work aims to encourage policymakers to make better choices to make good on the promise of the ADA. We seek to strengthen economic self-sufficiency, independent living, full participation, and equal opportunity for all disabled people. More than 1 in 4 adults in the United States has a disability. Therefore, all policy choices affect disabled Americans, and all policy is disability policy. Oh, thank you. That's right. I'm glad we all agree. Policy is a reflection of and a driver of a country's values. For most of this country's history, a common belief was that if disabled people didn't fit into society, they should be removed and institutionalized or hidden away without education, employment, leisure, belonging, and other rights. But today we have shifted toward a better collective understanding. More people understand that when an aspect of life is inaccessible to disabled people, it's because society has built it that way. Disability is defined by the restraints and barriers we, the people, have created and chosen and voted for. And accordingly, we can choose to remove those barriers. But this shift in understanding has ebbed and flowed. Last July, the so-called One Big Beautiful Bill Act passed, and it will take away Medicaid and other key services from disabled Americans of all ages. At the same time, federal agencies are being decimated. Last Friday, more than 4,000 federal workers were laid off, contributing to the attack on our federal infrastructure that upholds our rights, oversees our laws, and distributes critical funds. And because all policy is disability policy, an attack on any federal agency is an attack on disabled Americans. Let's run through some quick numbers of this attack on our federal infrastructure. Over the past year, the U.S. Treasury Department has lost nearly 1/4 of staff to cuts. More than 1,300 employees of the U.S. Department of Health and Human Services were fired last week, adding to the overall 14% staffing cuts to HHS. The U.S. Department of Housing and Urban Development has lost nearly 1/3 of its staff to cuts. Nearly 13,000 staff have been cut from the U.S. Department of Veterans Affairs, an agency that was born out of the urgent need for strong disability supports. And nearly every person at the U.S. Department of Education working to administer programs for students with disabilities in K-12 were suddenly fired last Friday. Overall, the Department of Ed staff has been cut by 43%. We're grateful for the breaking news that the courts are halting firings during the shutdown, and we really hope that they will also reverse these firings that have just happened last weekend. And so, although we have come a long way in our national understanding of life, liberty, and the pursuit of happiness, we still have miles to go. I've just given you a lot of stats, but our first panel today will bring to life the lived experience of real people and how that impact extends to all of us. Our conversation today is for everyone. Nearly everyone will eventually become disabled if they are not already. Everyone knows many people with disabilities, whether they are aware of that or not, and whether those disabilities are invisible or visible. And so I'm pleased to welcome you here to this conversation. Our first panel will feature experts sharing their lived experiences, and our second will feature my fellow New Americans reflecting on these stories and our work through a policy lens. we have an outstanding moderator for today's panels, Taryn Mackenzie Williams. She has an extensive resume, so this is a condensed version. She's currently a senior fellow for disability at the National Partnership for Women and Families and a national expert on disability employment policy. She most recently served as Assistant Secretary of Labor for Disability Employment Policy, where she led the Office of Disability Employment Policy, or ODEP, for the Biden-Harris administration. She has also served as Associate Director for Public Engagement and Liaison to the Disability Community at the White House during the Obama administration, and as a Policy Advisor for the U.S. Senate Help Committee under Senator Tom Harkin. I'm so excited for her to lead us through this conversation. Please welcome Taryn.
Thank you so much for that introduction, and thank you to New America for hosting such an important event. I want to acknowledge everyone who has joined us today, both in person and online. This is such an important issue right now, and I think Carrie really helped set the stage for what we're going to be talking about as a panel. But I just want to do a bit more reflection or setting the stage before we get to our guests. As we know, this is a banner year for disability policy. It is the 35th anniversary of the ADA. We will be celebrating 5 decades of IDEA. But I think when we look back at 2025, what we'll remember is the extent to which policy changes, particularly at the national level, have transformed and threatened disability rights as we know them. And I'd argue it's not just in this country, but given our role across the globe, we are transforming disability rights for all people with disabilities who live in this world. We have an opportunity right now. I think we're compelled to reimagine what it means to meet the promise of the ADA. Perhaps it's not what we wanted to do, but it's what we have the opportunity to do. But to do so, we need to reckon with the reality of those systems, the reality that these policy changes have created gaps and helped to open up fragility and fragmentation that already existed in the system. That's what we're going to hear about from our panelists today, the experts who have navigated and continue to navigate these systems. And it's truly my pleasure to introduce all of them. I'm going to ask during the first question that you introduce yourselves. I'm going to start in the room. And I'm going to ask this first question. And for a bit of mutual accountability, as someone who likes to talk, we're going to try to keep it to 4 minutes so we can hear from all the panelists and have that robust dialogue. So forgive me in advance to those online and to those in the room if I have to help us transition. But what have you encountered as the biggest barriers and challenges with our systems in this country? And how have fragmented systems most impacted you? And Ashley, if you could also introduce yourself. Thank you.
Thank you so much. Thank you. I'm just so flattered and honored to be here. I'm Dr. Ashlyn Murphy. I'm a former teacher of 12 years, and currently I'm a technical editor and writer. I'm a mom to a 5-year-old boy with autism, or I might say ASD, which is autism spectrum disorder. And I also have 3-year-old triplet daughters. So this gives me, gasp, I should have left a pause in there. But this gives me a really unique outlook on systems for people with disabilities and also caregivers of people with disabilities. So I'd love to start by discussing our experience with Medicaid, which is probably where we've encountered the most barriers because our family, as a family of 6 on 1 income, cannot afford health care outside of our plan. And I will say, too, that we're incredibly grateful for the support that we have, both locally and through state and federal government programs. My children and I have been on Medicaid since I got pregnant with the triplets. And I appreciate that this program is set up starting with pregnancy because there were many additional appointments and medical tests and procedures. I can't imagine paying even a copay for each appointment and test because I was in a medical facility sometimes multiple times per week, multiple times per day. That being said, we've had some challenges related to Medicaid and especially using it for my children. My son, as I said, has ASD, and my daughters were born prematurely because they're triplets. And our PCP can't satisfy the needs of my children with these disabilities. So we end up going to many different specialists depending on the need. Our Medicare or our Medicaid insurance requires a referral for all specialists. And this is the biggest barrier as a parent. I'm sure you can imagine how a referral for each specialist and each child, especially during an initial diagnosis process, really adds up for 4 children. So when starting the process to see a specialist, we knew that we needed a referral. So we initially tried calling our PCP. They gave us their generic pediatric referral. But this is actually what the specialist was asking for is an internal process, an internal document that we as Medicaid recipients and parents cannot see. We cannot see this document that they're asking for, this referral that they're referring to. So the specialist will call us. They'll request the referral. We call the PCP. We ask them to do the specific referral. And the first few times, this goes back and forth. Or for some of these appointments that are annual, this goes back and forth quite a bit. So we call the specialist again to ensure they receive the referral. Again, back and forth, and we're just kind of playing monkey in the middle here. But, because if we show up for the appointment without this referral, we won't be seen. So that's a huge barrier to consider, is that someone like us, especially, we live in very southern Maryland. So we're driving up to the specialist in DC or Baltimore. So we're driving anywhere from 1 to 3 hours. And so to make that trek without actually getting to see someone because we don't have the referral would be a huge waste for our family. And I also just wanted to say that there's another opportunity for policy to align with, people and families with disabilities, because gas, parking, especially in cities like Baltimore and DC, where we certainly have the best children's medical specialists, but those things really add up in addition to other medical expenses. So there's really an opportunity for policy alignment there.
Thank you. And we'll talk a little bit more about where there are opportunities for policy alignment. And I appreciate you sharing your story and what you've experienced with your children. We're going to move online. And so I will now turn to Chris. And Chris, same question. What have you encountered as the biggest barrier and challenges within our systems in this country? How have those fragmented systems impacted you? And please, if you could just say a bit about yourself as you start to respond.
Yeah, I'm Chris Worth. I'm a community organizer and a researcher with cerebral palsy. I have been organizing both in Appalachia and in Missouri for the last 20 years. So that's what I bring to the table. One of the barriers I think we possess, that we are constantly fighting in the community of people with disabilities, is that our stories get co-opted and sort of watered down by systems that make us constantly verify disability, right? My disability is a constant. It's not going away. I see it as a gift, right? I'm lucky to have that privilege. But so many of the people that I work with as a community organizer, they need to be reminded oftentimes that their power exists outside of these systems and they can influence these systems. So I think that's a barrier. I'm sorry if that's way high level thinking, but I think that's a big barrier that I see in the St. Louis region, and I think it's reflected around the country, actually.
Chris, I'm just going to interject. Your voice got a little bit low, and I want to make sure that our audience can hear you.
Could you hear me?
Yes,
I'm a little spastic. That's
understood.
that's the beauty of CP, right?
Thank you, Chris. We're so, oh, go ahead.
Thank you.
So we're going to move to Yossi. And Yossi, I'm going to ask you the same question. And that is, what have you encountered as some of the biggest barriers and challenges as you've navigated those fragmented systems that comprise our disability system? And could you just spend a little bit of time introducing yourself as well?
Thank you. So my name is Josie, everyone. Hi. I'm a disabled Chicana, first generation from south of Louisiana, literally down the bayou. I currently serve as a communications manager for New Disabled South, a regional organization based in the U.S. South fighting for disability justice. And if I look off to the side, it's because I have my notes. Your girl is a little anxious, so this is a way to keep me grounded. Okay, so some of the biggest barriers for me come from how disconnected and unrealistic these systems are. And I'll be talking a lot about benefits, healthcare, and transportation. Um, they're supposed to help disabled people live independently and thrive in community, but really they restrict us by implementing unrealistic standards that I would say not even non-disabled people could meet themselves. For example, disabled people on benefits like myself, I'm on IHSS, which is a caregiving. It's to get assistance for caregiving. So we're not allowed to make a certain amount of money before risking our support services. And let me just say, like, there is a way for you to earn money with like working programs, but even that threshold, it doesn't fully cover or reflect the actual current cost of living. Um, and disabled people deserve, well, no, because I think I have a problem with the word deserve. I think disabled people have the right. They should not have to prove or earn um, to live or to thrive in community. And so, my personal experience, for example, I'm currently working with a specialist to navigate my benefits. Um, Thanks to New Disabled South, I'm really like working through this and understanding how these benefits work. And I will say, like, um, it's been very much a journey because sometimes I get kind of scared to ask certain questions. I call them my under the table questions because as a disabled Latina, like we're constantly told like you need to be careful like what you say to people in like these positions of power. So like there's a disconnect right there. Because if you're too independent, you risk your support services. But if you're not dependent enough, then you don't qualify for those services. So it's been a very interesting journey to navigate that for myself. And of course, like also as disabled people of color, like if we say the wrong thing, we feel like we either have to completely start over the process, something happens where we have to start over, or we have to go to other people. Yeah.
Thank you so much for sharing that. And I definitely want to come back to something you said about the systems that are supposed to give us independence, in fact, restrict us. That's a theme that I've heard throughout. But now I want to turn to Alyssa. And Alyssa, I'll ask you the same question. What challenges or barriers have you encountered as you navigate the fragmented systems that support people with disabilities? And if you could spend just a little bit of time introducing yourself to our audience as well.
Hi, I am an artist, filmmaker, cultural worker. I use she, they pronouns and visual ID. I am a queer Asian person with shoulder length black hair and bangs. I'm wearing a pink knitted shirt with a blurred background in my office studio. Thanks for inviting me to share my lived experience as a disabled, chronically ill person with ADHD, myalgic encephalomyelitis, long COVID, and stage 4 endometriosis. So my three main barriers and challenges stems from the lack of accessible care in the for-profit healthcare system and health insurance. That includes insurance coverage gaps, long wait time for specialists, delayed insurance coverage, and enormous time we spent arguing over coverage for necessary treatment and appealing claims. It's really expensive to be sick in this country, and being sick is also a full-time job managing our health admin. And second, are the overall dismissal of long COVID and ME that's downplayed by Doctor Society and policies. It's estimated that there are at least 18 million Americans who have had or have long COVID. Some don't even know they have it. We are invisible, abandoned, and isolated. Normalizing masking and clear air solutions would make public indoor spaces less of a barrier to us. At the very minimum, this should be required in healthcare facilities. It's really unfortunate that basic public health measures like masks and vaccines are often spun as political issues, but in reality, they are fundamental acts of care. It's to protect oneself and others from respiratory illnesses other than COVID and long COVID. And third, discrimination in healthcare and medical gaslighting. Having my pain dismissed as all in my head has resulted in delays in treatment that would have drastically changed my health outcome if it was caught earlier. Medical gaslighting and discriminations disproportionately impacts women of color, especially Black women and LGBTQ community. For example, it takes an average of 7 years to get endometriosis diagnosis. We're often told it's just a period pain when in fact it's a whole body systemic disease that spreads like cancer. Yet it took me almost 20 years to get diagnosed, resulting in severe loss of function and organ removal. And with the rising costs of living costs and our current housing crisis, basic survival needs are becoming a privilege. We need more funding, not cuts. We need social benefit programs like Medicaid, Medicare, and SNAP more than ever. I'm really concerned with the millions of Americans who will suffer and die. We shouldn't be doing GoFundMe for life-saving procedures that cost 10 times more than other countries. And I really want to emphasize that the pandemic isn't over. The statistics are stark. Like 1 in 3 Americans who contract COVID will develop long COVID. And it could impact anyone regardless of how healthy or active they are. In fact, long COVID is now the most common chronic health problem affecting children, surpassing asthma. So we have a long way to go in terms of awareness and research, but in the meantime, as more Americans become disabled, we urgently need to build a stronger care system and to repeal the cuts to Medicaid that's going to pay for the tax cuts for the rich. Thanks.
Thank you. And as you were talking, I was reflecting, and I think people that I'm observing in the room were really reflecting on your words and how it is expensive to be sick and how so much of the work that you, again, all have said across these systems is in performing pain or suffering an administrative burden to just access the systems and the supports that you need to not only live, but also to thrive. But I want to go in a little bit of a different direction now. So I'm going to start with Chris. Chris, you said something that is rolling around my head, and it was our power is outside these systems. And I know your work has been focused on grassroots, something that we know is very critical in this moment as we see changes happening all across the nation. Can you speak to the importance of community organizing for disabled people, why it's so critical, and also maybe speak a little bit about what you said around the stories being co-opted and what it means to do that organizing and for it to be disability-led?
Really, grassroots community organizing is about the power of stories. It's about understanding that folks already have power to make change, and that that's not just about that real action is not just about all of the fancy direct action, although I love direct action. It's also about those conversations around a coffee table. It's about really valuing the power of the individual story. And I think that one of the reasons I was excited that New America asked me to be on the panel is because I think that too often those stories, that power, are kind of given over to systems. And I would like for folks to understand that that people, and the panel has already spoke to this a little bit, the people are the systems, right? So the value of the story is world changing. I think that too often we forget that. And rightly so, because we're always struggling to be seen. So, and sometimes we forget the power of that story. I think that what I meant by outside of systems is that I wish that people with disabilities understood, and neurotypical regularly ambulating people alike understood that these systems are should be thought of as partnerships, right? Should be thought of as partnerships because we are giving, as people with disabilities, we give so much of ourselves to mass culture, and it's not recognized to the full. They co-opt our story. Does that make sense?
Perfect sense to me. And it reminds me of something I hear often. And in full disclosure, I hear it from my mom when I'm going to the doctor and worried about experiencing medical gaslighting myself. And that is that the doctor might know medicine, but you know your own body and you have to fight for your body, and that relationship is a partnership. But we know that is often not the reality when we step foot in those offices. It's not the reality when we're going to fill out the paperwork to access supports and services. And Ashley, I want to come back to you because you talked about what it's like trying to access those services for your children and working within them, working outside them. What is that like? Share a little more.
Sure, yeah. And I would like to say, yes, I'm telling a lot of personal stories. I feel like everyone else on this panel is preaching. So thank you for your preaching words. It's really encouraging. So I think what I kind of want to focus on with this time is our experience with the Infants and Toddlers program. I might call it INT, but I've also heard people refer to it as the Child Find program. So as a parent of children under 5 years old, our first line of resources for developmental delays in children and infants is our local INT program. So for our family, we started with speech services for my son when he was 18 months old. And we were assured that once his language was more easily understood, that his aggression and self-harm behaviors would reduce. He would bang his head on walls and doors so hard that he would have a bruise in the same spot for months. I can picture it now. I'm so sorry, that didn't need to bring out some emotion. That was a little surprising for me. At one point, he banged his head so hard against a door that he shattered a glass panel. So I'm sure you can imagine how scary that is if you're a parent, or maybe even if you're not. These were scary behaviors. And despite positive and supportive INT experiences, we still felt that there were unexplained behaviors from our son. And after advocating and pushing for more answers about his behavior, and even with documented improvements in his speech, I specifically asked about an ASD diagnosis just after the age of 2. The INT program specialist insisted that ASD didn't apply because he was so social. However, as an educator, I know that ASD takes many different forms. And frankly, it's an old belief to consider that all ASD children and people are non-social or antisocial. So I proceeded to request a neurodivergence and disability diagnosis from them. So the INT team came to our home, a preferred environment for our child. And we greatly appreciated the convenience of this because we could have our triplet girls down for a nap during this assessment and really focus on the experience. However, the assessment showed that he was academically high scoring, which again is common for children with ASD, and it barely took parental experience into account, meaning that we consistently saw sensory sensitivities in our home, but their interview and exam during a 30-minute period didn't show that, so he wasn't marked as having sensory needs. After getting no diagnosis from INT, I continued to advocate, but it meant waiting 9 months for a specialist at Children's National. I'm now being told that, actually, I know from experience that Children's National is actually not accepting people for the diagnoses that I was seeking at the time, and I'm being told that Kennedy Krieger Institute, which is also a resource for families like mine, is a 2-year wait for some people. But by that point, again, after this 9-month wait, after the 6 months and the starting at 18 months old, at that point, he was almost 4, and he didn't have any documented accommodations in school or his individualized family service plan, which is like an IEP for toddlers at home. I'm glad that I continued to advocate for my son and his needs, but I'm concerned about the time it took to get the diagnosis and the process for doing so. Research says early diagnosis and intervention is the best way to support people with disabilities. But it was over 2 years from when we sought INT services to getting an ASD diagnosis, despite documented delays. And again, this service came with a cost. Rather than using the frankly convenient INT services, I had to take off from work to care for my triplets so my husband could drive up to DC for my son's evaluation. Between the drive and the assessment itself, it took all day, also meaning my son missed an entire day of school for this, and he was quite dysregulated by the end of it. I could go on, but that was just the diagnosis process. Getting support for a child with social versions, I say social in quotes, because again, I don't think that's a good definer of ASD. But for social versions of ASD in the INT program or even the public schools has been challenging. But I hope this little bit of my experience has been informative to stakeholders listening in discussing how we can bridge this gap between policy and experiences for people and caregivers with disabilities.
Thank you, Ashlyn. And I hear as you share what you and your family experienced in getting that diagnosis. There was echoes of what we heard from Alyssa and talking about how to get just that diagnosis of long COVID, how to get the understanding of what it is and how it affects you, and the millions or the numbers that we don't yet know because it's still happening. I wonder if you could talk a little bit about what you've experienced in the workplace. So in an environment where you're struggling with getting a diagnosis, you understand that you need accommodations, you're having those conversations. What has that experience been?
Yeah, so like the current job market is already really tough, and it's more difficult for disabled people to find a job that is willing to hire us and provide accommodations. Like the biggest myth of hiring disabled people is that workplace accommodation is too expensive. However, 57% of employers reported spending nothing on accommodations, 80% spend less than $500. The typical accommodations, including flexibility to work from home, which we saw during the pandemic, shows that most workplace has the capacity to allow for accommodations without disrupting teamwork. Accessible workplace benefits everybody. It's really unfortunate that it's so common for disabled people to get fired after asking for reasonable accommodation, and that's what happened to me. I found out the hard way that federally, ADA only applies to workplace with over 15 employees. Also, I'm autistic. Autistic are the most unemployed class in the disabled group. Over 70% of autistics are unemployed. Workplaces are missing out on the strength of neurodivergent folks. Because, like, have you met an autistic person when their job is their special interest? Combined with our hyper focus, we're actually an incredible asset. And I also want to mention that the upcoming work requirements of 20 hours to keep Medicaid will be devastating for the long COVID, ME, and other chronic illness community. Most of us will not be able to meet that requirement in a job market that won't hire us to begin with. So, like, disabled and chronically ill people are seen as disposable and useless under capitalism, since the system cannot extract capital out of our bodies. This notion that people are only as worthy as our labor or productivity is really untrue and harmful. One of my favorite disability stories that I want to share is from Zhuangzi. He's a Chinese Taoist philosopher from the 4th century BC. So the story goes, one day a carpenter takes a walk with Zhuangzi, showing him what he considers good trees to work with, and then he pointed out to a knotted crooked tree as a useless tree that he cannot work with. Zhuangzi replied, well, because it is useless, it will live long after the nearby trees are cut down, and it will also continue to provide shade to people. Its uselessness is its greatest advantage. And same goes with people. Um, the perception that we're useless is not true. You just haven't seen us when we are performing our potential. So when I was in recovery from a major surgery, it was my unemployed and underemployed friends who were available to take care of us. And we all have friends who had to quit their jobs to become full-time caretakers to their parents or loved ones. And I would argue that that is not useless. So disabled and chronically ill people are truly canaries in the coal mine, and when systems are falling apart, we are the first to experience it. In fact, we've been sounding the alarm since the pandemic, and we really hope that you will listen to us. And I think that's my thing. Thank you.
Thank you. And I'll just reflect to you that I see a lot of nodding heads as you were speaking, really as everyone is speaking about their experiences and their story navigating these systems. And Yossi, I said I would come back to you and sort of this picture that you painted and that others have painted about a world where you are, through these programs, supposed to have independence. You're supposed to have the supports that you need to meet the promise of the ADA. But in fact, they are fragmented and they restrict you even further. And work requirements could be a perfect example of restricting you even further and requiring you to take on this burden. Can you talk a little bit more about how you've navigated those disconnected systems and where you found your power?
Yes. So let me just say, like a lot of people on this panel, I've experienced the gaps in our system within many different lenses. Mine is disability, race, language, and also geography. I am from Southern Louisiana, again, the Bayou. And if you were to picture the state of Louisiana on the map, it looks like a sock. And there's a bunch of little strands. And my town, well, the area that I'm from is called cut off. We're literally cut off from everyone. Um, and so I grew up translating paperwork policies from my mom and also interpreting. Um, and even as a connected to now, some benefit offices don't have interpreters on site. Materials aren't in plain language, which is helpful for people who speak a second language. And this was really, oh, and before I keep going further, but there's also a deep disconnect and a lack of trust between communities of color and, of course, people working in these systems, because many of us have experienced discrimination or violence when we ask for help. So even though there is support, it doesn't always feel safe or accessible to. With all of this said, what I've experienced expands from education to even experiencing a natural disaster to even COVID and how they're all related. So in terms of trying to access benefits, healthcare, and transportation, and all of these things together, they're created without people of color, my disabled people. For example, when I was at Tulane State University, I was afraid to name them before, but now I'm not. I was trying to navigate benefits, healthcare, and transportation at the same time, because these were some things that Tulane did offer. But as a disabled person, they restricted it. And if you're not from New Orleans, then let me just say, it is so hard on wheelchair users to navigate the city. Really any disabled person. And so because I couldn't rely on the school, I ended up trying to rely on the state. However, I'm just one person in the entire city of Louisiana, trying to get on this list that a lot of people are on. And so I wouldn't have been able to even get on any of these services within the time frame of the graduate program that I was studying in. And many of you brought up COVID, and a month before COVID, I was trying to access remote services in my second semester for the graduate program, and I was told that it would be impossible for me to have a remote option. And then a month after, this happened in February, a month after in March, COVID happens, and I get an email from my program. We are fully going online. But by then, I had already taken a medical leave, which is one of the choices that I found out later on that disabled people often take, or medical leaves. They're recommended it by the university, which I realized then it was a way for the university to cover themselves. So if something were to happen legally, they could say, well, they took a medical leave. And so I've been trying to navigate all of these things you know, and I shamed myself for the longest time saying like I should have been able to provide all of these things. And it took a while, and it took speaking to a lot of disabled people who have that exact same experience, not just in the South, but across the country, of them trying to navigate all of these things, because we're not supposed to be like disabled advocates in school. We're supposed to be just students in school. Um, and so that is how I learned a lot of my power, and that I do have a voice, and I wasn't afraid to use it, and I'm not now.
That there were snaps and in the room, and I before we move to this last question, I just want to pause and reflect back to you that sharing your stories is your power, but it also is a form of labor. So I just want to say thank you for coming, for being willing to share your story, for continuing to show up in a world that makes you prove your existence and your value over and over and over again. We know it shouldn't be this way. We know it doesn't have to be this way. And you, as experts, and you, with all your lived experience, if you could, in this world that we're reckoning with, this fast evolving world, and we're trying to reimagine what it could be like to have systems that actually serve us. I'm going to ask each of you, what is one change you would make? If you could go to disability or policymakers, which is all policymakers, and say, this is one change you could make, what would it be? And I don't want to put pressure on you, but I'm going to turn to you, Ashlyn, and ask you first.
That's fine. It's pretty broad over here. So, and those are really empowering words. I would say the biggest thing we can do is to provide more healthcare and education options, outlets, and coverage for families, including but certainly not limited to infants, children, and women. It seems to me, as Carrie mentioned, that although I suppose it doesn't just seem to me, that it's the truth, that the federal government and some states following suit are insistent on cutting healthcare and education experiences for vulnerable people, including people with disabilities and their families. I could give many specific examples of this, but I will simply say this. It is counterproductive and it is inhumane. This is not American, and this is certainly not the future the ADA promised, again, as Carrie alluded to. We as Americans are better and can do better to support people with disabilities and their families and caregivers. Thank you.
Thank you. I'm going to turn to those online, and I'll go to you, Chris.
So I think starting to recognize disability as an identity that has added to mass culture since the High Paleolithic period, right? And understanding that our disabilities are not just about our vulnerabilities, but we bring strength within that context. That's what I would like policymakers to begin to understand. Here in Missouri, we hear all about the vulnerable populations. Yes, I need systems to support me, right? But you are gaining something from me as able-bodied people, and you've been doing it historically since there were civilizations, so I think that we need to take that into account. I know that's way broader than just everyday policy, but I think that if we started to see people with disabilities as adding to the to our mass story, then I think people would people in people would begin to remove those barriers naturally. I don't know if
Thank you.
any of that made sense.
It made perfect sense to me. I think you were sort of lifting up something that we're seeing every day, which is how you see people in your community, in cities that you maybe have never visited. That really affects and influences how you approach policy. And if you don't see them, then there absolutely could be a lot of harm. I'm going to move to you, Yossi, with the same question. If you could make one change in disability policy, what would it be?
So if I could influence one big change, thinking of currently, like right now, I'd lift all restrictions on income and savings. Disabled people have the right to survive and thrive in community, not just get by. I'd also remove, sorry, I know you said one change. I have a lot of demands. I'd remove the surveillance that comes with accessing these systems. I could say a lot about how harmful it is, like these assumptions that disabled people were like living off of these systems or we don't really need it. But the truth is, like, disabled are not. And we're living in a time where like people who aren't, by the way, in positions of power or benefiting from these systems, like a lot of people need support right now. And who are you to decide how much someone needs help? And I will also just one last thing add. Um, you shouldn't just care about disability just because you could one day become disabled yourself. You should just care. And that's all I have.
Thank you. And Alyssa, same question.
We need to work towards Medicaid for all. Access to healthcare is a universal human right, but something that's doable right now as our first step for policymaker is to make telehealth permanent. Medicare just lost access to telehealth, which impacts rural, elder, and disabled people. I would also like to share a bit of history as we close. Before the Holocaust started in 1941, Hitler began what's called the Action T4 in 1939, murdering disabled people in gas chambers. The T4 program became the model for genocides of Jews, gays, and Romas. We are following this playbook with the violence that's rolled out against disabled people with Medicaid cuts, anti-trans legislations, and ICE raids. It's not a hyperbole that this will result in mass death. After World War II, prominent German pastor Martin Niemöller publicly spoke about his own early complicity with the Nazi and his eventual change of heart. He famously said, "First, they came for the socialists, and I did not speak out because I was not a socialist." We know how this poem ends. We still have a chance to change how this poem ends for us. Thank you.
Thank you. I will again say thank you to our panelists for sharing your stories, for doing what you just heard, which is speaking out and beginning to build that picture of what our world could be, what this country could be, if it met the promise of the ADA and met the promise of true equal opportunity. We're going to conclude this panel and then transition into another panel, so stick with us. But again, please join me in saying thank you to our panelists. All right, that was a quick transition. Thank you for sticking with us, and welcome back, everyone. We are going to jump right in where we left off, and as you all heard, our first panel shared their lived experience, their expertise in navigating these fragmented and incredibly fragile systems that we've built up into this complexity meant to support people with disabilities in this country. And they've showed us in their stories the burden that they experience as they navigate these systems and the goal of meeting that promise of the ADA. I keep coming back to that because advocates fought so hard for the ideals that are memorialized in the ADA. In this next panel, we're going to delve a little bit more into the policy areas. So one way of putting that is zooming up. We're in DC. We're going to talk about what these systems are and how they might be improved. And similar to the first panel, I'm going to ask with this first question for folks to introduce yourselves as you answer the first question. And I will start with Jasmine.
Hi, I'm Jasmine Owens. I am currently serving as a senior policy advisor working on pre-K-12 issues. So right now, my work is focused on kind of external affairs, engaging with like partner organizations, but really focused on how the harms coming out of the current administration are impacting public schools and finding ways for us to fight for a strong public education system. So right now, I think beyond the actions of this administration being a problem to solve, I think that a lot of kind of the issues in public education, like around class sizes, teacher pay, many of the things that we've been kind of working on in the public education space for a long time all boil down to how we value public education. And I think that generally individuals and kind of like local communities value public education, but as a country, we've really deprioritized it. And I think that the experiences of teaching and the experience of being a student, the experience of just kind of like being in public school systems is not one that we really spend a lot of time looking at the benefits of. We're always looking at the outcomes, like what are students learning? Are they getting the thing that we've imparted to them? But we don't think about kind of what that means for building global citizens and how we kind of enter into the context of our world, and using schools as a place where that really begins. So I think that the mechanism by which we do this work kind of shifts and changes depending on like what specific issue we're talking about, but I really do think it all boils down to how we value the time that we spend in the classroom, whether it's on the student side or the educator side.
Thank you. And you answered the question I didn't ask because I didn't ask it when I returned to you. So I'm going to actually ask the question now. So as you introduce yourselves, if you could talk about the system that you work within and what are the biggest problems that you see? And I will turn to Vicki.
Sure, thanks so much. My name is Vicki Shabo. I use she, her pronouns. I am a senior fellow here through the Better Life Lab and the Family Economic Security Cluster, focus on paid family and medical leave, paid sick time, equal pay, pregnancy discrimination. Used to be at the National Partnership for Women and Families, so excited to have you here giving expert moderation. So I work on labor, economic, and sort of work, family, and care policy, as you might expect from my title and sort of the work that I've been doing. I'm also a mom to a kid who is neurodivergent. I am a daughter to a father who is disabled and relies on caregivers, paid caregivers, as well as informal care. So I think that just like underscores that disability is something that affects many people. You might not know it. The way that people encounter sort of these hidden things in workplaces is that our workplaces aren't set up to acknowledge that people are caregivers and workers. They're not set up to acknowledge that people might have not just visible but invisible disabilities. And I think the essentialism of like we think a lot about outputs in education. I think, the GDP is a great example. Like we focus a lot on productivity at work and on outputs and on ROI, and we don't focus a lot on experiences in workplaces, sort of by and large. And so that means, just 27% of workers in the United States have paid family leave through their jobs. Only about 4 in 10 have short-term disability insurance, which provides partial pay for your own serious health issue or a temporary disability or something that gets in the way of you going to work for a period of weeks or months. About 30% of Americans don't have a single paid sick day, and that is higher among service workers and hourly workers. The pay gap as a result of many, many policies is substantial for women and women of color, but also for people with disabilities. We talked already about wages being low and employment being difficult to find. And so those are all the ways in which my work is influenced by and seeks to influence inclusion. But yeah, just really excited to be here and think about how, as we imagine the world and the country that we want to come next, how we really do create opportunities and security for everybody.
Yeah, I appreciate what you both have shared because you're already demonstrating what was said at the beginning by Carrie, and I'm going to move to you, which is that all policy is disability policy, and we need to think about it in that way. And I'm wondering if you, Carrie, can answer that same question about the work that you do, and also maybe a brief reintroduction of yourself for the audience.
Yeah, I'm happy to. So I'm Carrie Gillespie. I am the project director for early development and disability here at New America. And I started my career as an educator and a researcher and clinician and school psychologist in the schools. And as I worked across 5 different states in several different schools, that's what really sparked for me, really made me angry, actually, the desire to move into policy, because I kept getting angry and upset about things I saw. For instance, the fact that a student living in one state could be found eligible for special education, but if that same student lived in the state next door, they would not be found eligible. And of course, that's not based on science. That's based on policy choices and priorities, and lack of funding, and lack of respecting and valuing the people that educate and work with students with disabilities. So it also frustrated me that I had learned, as I trained to be a school psychologist, all these really interesting and evidence-based prevention strategies and intervention strategies for social emotional supports and mental health. Did I get to use that? Almost never. I worked in districts with families with lower incomes and with families with very high incomes. And as you might imagine, in the more highly resourced districts, I did get more of a chance to use those very cool, innovative strategies because I had more downtime and resources and staffing. And in the lower income districts, I did not. It was a triage, and it was just doing the best we could every day with very few resources. And then finally, the other thing that I saw over and over again was that, of course, students of color with disabilities face so many barriers. I saw the real intersection of the racism baked into the education system intersecting with the ableism baked into the education system, and how that played out time and time again. So those are all some of the problems I saw. And the biggest problem I'm seeking to solve, when it boils down to it, is that we have so much science and research telling us we know what works so much of the time, but there is this gap we have to bridge between the science and evidence and lived experiences and stories. We have to bridge that gap with policies and what's actually happening in the classroom.
Thank you. And now I'm going to turn online. I want to just make sure. And same question. Can you tell us a little bit about yourself and the systems that you work within, and what are the biggest problems that you face?
Great. Hi, my name is An May, and I lead our Teaching, Learning, and Tech initiative at New America. I'm an Asian woman. I have 2 young adult children. I have shoulder-length black hair, and I'm wearing a dark brown jacket and my favorite earrings today, currently. Broadly, I would say that our work that we do in TLT focuses on advancing policies and practices that are designed to support educators' use of technology for students that are both learning in and out of the school setting, so in this classroom and out of the classroom. And our primary goal is to improve student learning by making sure sure that educators have the resources, skills, and technologies to provide, instruction that is of high quality and it's meaningful for young people. And the way we support this is we do this by conducting and culling research, particular research that raises voices from the ground. So much of what you heard from the first panel are definitely the kind of voices we like to bring in and lift up and to inform the policies and practices that need to occur. And we do this by bringing people together in a room who need to design and build together. So we bring the learners, the designers, developers, educators, policymakers, research, and advocates together to actually understand where each of the roles are and how they can help impact each other. And one of our first disability policy events we did was in June of 2023. And Elena Silva and Lily Hagel, who have gone on to other pastures, but were in New America, but I understand are in the room, and myself partnered with now the defunct Office of Ed Tech. And despite the setbacks and the miles to go that Carrie mentioned in her introduction at the beginning, I would say that we are even more determined now to be the firefighters and architects on behalf of learners with disabilities, particularly around practice and policy and implementation. Your question about the biggest challenge, I think regardless of technology, this has always been an education about creating learning opportunities that are meaningful to the diversity of students that attend all of our public schools. And that is actually the question that people need to start with and not around technology. So what do we want our schools to be? We want them to inspire and support young people and give them purpose, right, for what they want to do with their lives and do it in a safe environment that's both physically and emotionally safe for all of them. And that is one of the goals. And we know if we do technology well, it can be a tool towards this goal. It is just a tool. It can support students with diverse educational needs. And now with AI can be a game changer if we do it right. Bruce Alter, that we've worked with quite often, is a physical therapist and an assistive technology consultant, says that for him, who has been designing these things and who himself has a learning disability, this is the first time we've had tools that are needed for the most severely disabled kids to fully express themselves and to achieve and to have high academic achievement. He sees the power of AI in doing this if we do it well. But understanding the potential misuse and abuse of AI is essential, right? To really creating the kind of inclusive and effective things that we need to adapt. And one of my favorite researchers and designers is Jutta Trevernes, who I think she's often, called, she calls herself like the Debbie Downer of all this. But what she says is really key. She says that right now, is that AI must move at the speed of trust, is what she sees it at. And that what is happening right now is that AI is prioritizing, or the people who are pushing it are prioritizing believability over truth and popularity over fairness, which disproportionately harms marginalized groups like people with disabilities. So rather than move towards a single design, Utah is practicing what she calls her virtuous tornado, that if we focus our resources and actually build for learners with disabilities, you will be designing for all learners, which is exactly what Carrie was mentioning in the beginning.
Yeah, I love that the vision that you were building. And really, you all built a vision of what the world could be like if we didn't just focus on outcomes, if we understood that ableism and racism intersect with all the other isms, and frankly, that all policy is disability policy. I'm going to come back to you, Jasmine, and ask about civil rights. We absolutely know that civil rights protections are essential. It's something that we talked about during the earlier panel. It's really the base of this notion that policy is disability policy. Based on your experience examining civil rights issues, what do you see as the biggest roadblocks or challenges for people with disabilities? And where are their opportunities?
I think the roadblocks and challenges in my mind are twofold. One is funding. I think that's probably the most obvious. And I know that we're talking about ADA right now, but IDEA is also a law that's in place, and it promised 40% of funding to be covered by the feds, and they have never come close to fulfilling that promise. So in addition to that promise still being unfulfilled, the current administration is taking this opportunity to just decimate programs and money that has been set aside for really, really vital initiatives that students with disabilities, that English learners, that really all students would benefit from. So money, I think, is probably the first and most obvious roadblock. And I think the second roadblock or challenge is, especially now in this current administration, is the lack of staff that is working now on behalf of students with disabilities. We heard about the layoffs that happened over the weekend. We've been hearing about layoffs across federal agencies since the beginning of the year. The primary purpose for the Office for Civil Rights was to stand up for students and families, to give them recourse when they've experienced a civil rights violation. Those people are not in place, and they are not looking out for the students that need them. But I do think that the opportunity there is that states and localities can and should be stepping up to fill in that gap. Will they is another question, but there really is an opportunity for them to say, we see that the feds have stepped back, and we can step in and fill in this space where we have students that really need our support. Those are hard challenges to overcome, especially right now, but I do think that there are some real opportunities for us to do some serious advocacy in terms of arming our states and our localities with what they need to really support students with disabilities.
Yeah, thank you for that. I have so many thoughts and responses to what you said. I just want to note, I appreciate that you, as well as Carrie, brought up what's happening with federal staff. I think I read something this morning from a former colleague talking about public servants as patriots. They care, just as everyone in this room, whether it be virtual or in person, care very much about this work. And to be vilified is in itself harm. That is a not so great segue, but I do want to come back to you, Carrie, and ask you about your experience when you were doing early childhood, and ask you to talk or maybe expand a little bit more about what fueled that fire, what fueled the frustrations, and what barriers stand in the way of truly ensuring that children with disabilities get the education they need.
There are two main things of the many things we know about how to support children with disabilities. One is that the earlier you start providing those supports, the better. And that would include maternal care as well as infant care. And that supporting the whole family and not just the baby or child with disabilities is really key. And we have so much research that shows us that. And we have research showing the academic and social emotional benefits. But if that's not your thing, we also have ROI research showing the dollar amounts you can save as a state in special education funding. Take your pick, but we know what works and what works well, and we're just making the choice not to fund it. And so, for instance, we know that Part C of IDEA, early intervention services, work really well when they're done in a high quality, culturally sustaining way. But we are not serving nearly enough infants and toddlers and their families. It's a program set up with the family as the unit, as it should be, supporting the whole family, providing parents and caregivers with support, not just the child. But as a report we put out last week with New America's New Practice Lab shows, even babies in the NICU who under state policy are automatically eligible for early intervention are not getting into early intervention. These are NICU babies automatically eligible. So there's a real breakdown there. We have the policy in place, but what's happening with the implementation? And it's complicated, but I think we could guess some of the things that are happening. It's underfunded. There isn't enough staff. We don't value and respect the people in the system providing the early intervention. But again, these are all choices. And if it was fully funded and if we had more cohesive and less siloed systems in this constellation of supports for families, things would work a lot more smoothly. And we would reap all these great benefits that we know early intervention can provide. And since Medicaid has come up several times, I'll just say the Medicaid cuts are a huge threat to early intervention. Medicaid funds nearly a third of all early intervention services. So if we cut Medicaid, that's going to be a real problem for infants and toddlers with disabilities and developmental delays in their families.
Thank you so much for that. And so we're going to move again to you on May. And similar question. We've already talked about the barriers across systems. We acknowledged in your remarks how there are both opportunities and could be peril in the use of technology for children and adults with disabilities, and frankly, everyone. And I'm wondering, from your perspective, can you just say a little bit about the critical policy steps that can take place to ensure that ed tech and digital learning environments are designed inclusively?
I think right now, especially now, technology in the education, it's got to be safe, it's got to be effective, and it's got to be free from the algorithmic discrimination that a lot of people are talking about. And so that requires safeguarding student privacy, ensuring transparency, and how that tech is used. And in order to do this, you need human oversight over this and interventions to make sure that students, especially with disabilities, have access to like human educators who can address these challenges or biases that might arise from it. So it has to be human-centered in terms of the policy. And I think the other is like any tech policy needs to be aligned with these rights, right? In order to fully, exploit tech. We should be exploiting tech for good in a way that creates more inclusivity and equitable opportunities for students. And that's on us to be able to create those policies. And so those guardrails need to be put in place. We need to make sure that the data that is used is safe and unbiased. And part of that is making sure that school districts are prioritizing teacher training. And that is probably the bigger part of it, is making sure that the opportunities to use AI, how to evaluate it, is done in a way that it's also co-designed with the learners, who are using it. So, and it needs to be like a forethought rather than an afterthought.
Yeah, thank you for that. And as we start to close out our event, we definitely want our guests and the audience to have some takeaways that all policy, and I think you heard that all policy is disability policy, that the people closest to the issue must be centered in that policy making. And given some of these takeaways, I'm wondering, it's going to be rapid fire, if you all could just say perhaps one more, I'll answer one more question about what it will take to advance disability policy in this current environment. And I'll start with you, Karen.
I have a quick one. More people with disabilities as policymakers.
I'm going to look at you, Vicki.
Well, definitely +1 on that. I was going to say more stories, like the stories that we heard today, stories in communities that are represented by people who don't agree with the policy options that we might want here. And yeah, I think, unfortunately, really pointing out the multiple harms that are occurring or about to occur and what that means for families, for communities, for the country, in all of the dimensions that we think about.
Yeah, thank you for that. And I just want to tease out that you said showing the multiple harms that are going to occur, that are occurring. I mean, the fact is we know that there will be harms because we have evidence about what works and what doesn't work. And if we just turn to the evidence.
Well, and also lost opportunities.
Absolutely. Absolutely. I'm going to turn to you on May for the same question.
I will build on what both my colleagues just said absolutely the case, but I think we also need to start from a tech standpoint with what's the change we're seeking? What are the outcomes we want? What do we want for young people? What do we want for learners with disabilities before turning to the question of how technology can be helpful?
And Jasmine, I'm going to give you the last word in building this world where people are safe and free.
Yeah, I would just add to what you said, Vicky, about stories. I think that that is important, but I also think that those stories need to be told from the voices and with the words of people with disabilities and not through our voices and our lenses. I have been thinking about what Chris said in the first panel about their stories being watered down through systems. And there's a real opportunity to not water them down, to let people tell their own stories and have their partners uplift them in places where they need to be. But I do think that that is so vitally important right now.
Thank you. And really, thank you to all the panelists for sharing your stories. Please join me in giving them a round of applause. And we are going to close, but I do want to say just one more time, we know what works. We know what works well. As Carrie said, we have to make the choice to fund it, and we have to continue to fight and center the voices of people with disabilities. The experiences and the expertise will lead the way. So thank you again, not just to our panelists, but for everyone who joined us and who are in that fight right now. Thank you.
Simply the best, the best. I will make this short because for those folks here, we do have wine, beer, and food outside. And so as our population of people with disabilities continues to grow, our existing framework and fragmented policies and systems, it's untenable and we need better. We can't operate in silos, as we talked about today. And we need cross-sector approaches, but most of all, we need the will and the interest to make the choice to invest in supporting people with disabilities. And I think that Yossi's example of remote learning really brought it all home for me. That school went from saying remote learning is simply impossible to when everyone needed remote learning, suddenly it was actually mandatory. So that is such a good metaphor to me for our country and how we think about disability. Right now, people say things are impossible or too complicated or too expensive, but actually we have everything we need to do the things. We just haven't had the pressure to make those changes happen. So let's together uphold or try to uphold the promise of ADA by keeping on these conversations, listening to one another, embracing new solutions, and thank you again for joining us today. And those of you, if you're here in person, please join us for some mingling, conversation, wine, beer, food, soda. We'd love to chat.